Hi everyone, welcome back to another episode of Midnight Mental Talk. My name is Adrienne and my co-host slash friend Leanne is here as well. This week we are stepping away from anorexia nervosa and we're talking about bulimia nervosa this week. So we're just going to talk about and discuss some statistics in this video this week. So yeah, how about I start with a definition of bulimia, shall I? The definition of bulimia, which also we call bulimia nervosa, is an eating disorder that is characterized by episodes. It is followed by inappropriate methods of weight control, such as self-induced vomiting, which is called purging, and abuse of laxatives and diuretics, as well as excessive exercise. So basically, bulimia is a way of maintaining your weight in a very unhealthy fashion.
So we all know that eating disorders is one of the most fatal mental illnesses. And while most of us assume that it's a women-based disease, we always forget that men get it too. I want to remind everybody that men are just as susceptible to any eating disorder as a woman is. Just remember that whatever Adrienne lists as for symptoms or warning signs, anything like that, also applies to men. A few statistics, because I always get the boring statistics for you.
I don't think they're boring. I think they're quite interesting.
About 27% of girls aged 12 to 18 have significant symptoms. 31% of females are usually college students. And 46% of 10-year-old girls are dieting, have a fear of fatness, or binge eat. Doctors are seeing a growing group of women in their 30s, 40s, and 50s with eating disorders as well. And they also, this website here, the Eating Disorder Foundation.org, also says, while less common, boys and men can also have eating disorders, especially self-induced vomiting and inappropriate laxative use. Basically, studies have found that men with eating disorders tend to have a more passive-aggressive personality style and have had negative reactions to their bodies from their peers while growing up. And research indicates that anorexic males anorexic males tend to have more dependent and avoidant personalities.
Anorexia, I think, is more common and more steady because it's more prevalent as opposed to bulimia, so...
For males in particular, it does suggest that recurrent episodes of binge eating an amount of food that is definitely larger than most people would eat during a similar period of time and under similar circumstances, a sense of lack of control over eating during binge episodes, recurrent purging or compensatory behavior to prevent weight gain. You've mentioned this, like secretive self-induced vomiting, laxatives, diuretics, or fasting, compulsive exercise. And then another characteristic is hoarding of food, hiding food, and eating in secret. Frequently weighing yourself, preoccupation with food, focus on certain body parts like your butt, thighs, or stomach, and they're disgusted with body size or shape, or distortion of body size, like feels fat even though he may be thin. And for a male, they're saying emotional and mental characteristics are intense fear of becoming fat or gaining weight, performance and appearance orientated, works hard to please others, depression, social isolation, possible conflict over gender identity or sexual orientation, strong need to be in control, difficulty expressing feelings, feelings of worthlessness, uses weight, appearance, and achievement as measures of worth, rigid, inflexible, all or nothing thinking. And male physical characteristics include weight fluctuations, loss of dental enamel due to self-induced vomiting, edema, fluid retention or bloating, constipation, swollen...
Salivary gland?
Yes, thank you. Cardiac arrhythmia due to electrolyte imbalances, esophageal tears, gastric rupture, and lack of energy, and of course fatigue. So if you're male, please watch out for these characteristics.
And a lot of those symptoms do correspond with women as well.
Apparently there is exercise bulimia. It says it's similar to other forms of bulimia, except the individual uses excessive exercise as the predominant method of purging. And sometimes the individual believes that they are doing what they are doing is okay because exercise is healthy, but in reality, they are doing the psychological and physical damage to their bodies.
You mentioning that actually brings me to the thing that I actually want to talk about. Now, bulimia is categorized in two different ways. You have the purging bulimia, which is you regularly induce vomiting or misuse laxatives and diuretics, or even enemas after you binge eat. Then there's, which is what Leanne mentioned, is that you use other methods to rid yourself of calories and prevent weight gain, such as your fasting, strict dieting, and excessive exercise. So I have seen people in my life who eat something and they gain maybe 2 pounds and they're off running for 5 miles or until they lose that weight. So, and the problem is that part is it's probably not as serious, but it happens to a lot more people than we think it does. Like, even if they're not having the binging aspect, but say they go out for a weekend with friends, whatever, they come home, they gain 5 pounds, they kind of have a sort of meltdown inside, and it's like they have to burn that off. I have actually heard of individuals who have eaten, and then when they go to the bathroom, they, going the number two, they will take that and they will weigh it, and somehow they will make it so that it would work. Like if it weighs so much, that means they got rid of so much of the foods that they ate. Or they would even measure or weigh their vomit to ensure that they get all the food out of their bellies. So those are very extreme and hazardous ways of dealing with your weight gain. So not the weight gain, but your disorder. Abusing laxatives isn't good for you because you hurt your stomach, your colon. You could end up with intestinal bleedings and tears, and eventually maybe those 2 laxatives that you take can turn into 6 laxatives that you have to take. And those 6 laxatives will turn into 12 or 20. You may end up taking a whole box of laxatives by the end of the day. And these are things that are very extreme, but it's killing your insides. As I'm saying this, I will explain some of the things that your body goes through if you're a person with bulimia. You end up with anemia. You have irregular heartbeats, your muscles weakened, and you have heart failure, low pulse, and blood pressure, which can cause a lot of problems for yourself, like fainting, heart palpitations on a regular basis, just from walking up the stairs. And you end up with depression, or you have some fear of gaining weight, anxiety and dizziness, shame, and low self-esteem. Your cheeks become swollen, and they're sore. Your mouth becomes essentially a mess. You develop cavities, and your enamel on your teeth become thin and worn. With that being said, your throat and your esophagus is also being torn and worn down because of the fact that you're inducing the vomiting, and also from your fingernails or your nails or whatever you are using to induce vomiting. You end up developing stomach ulcers, pains that all can rupture. Your stomach will delay emptying, as in it will prevent itself from releasing the food or the nutrition into your bowels. Abrasions on your knuckles. Obviously, that's kind of obvious. That's like your fingers going down your throat. Your intestines, you become constipated, irregular bowel movements, bloating, diarrhea, abdominal cramping. Apparently, if you're a woman, you can have an abstinence period as well. If you are an individual with bulimia or are currently going through the motions of so, you're going to be putting your body through a lot of trauma and pain and torture. And if there's anybody in my life, I know people that could tell you that it's not a pleasant experience, and it will last you the rest of your life. As I was saying, it seems like, if you are bulimic, you're going to have a lot more problems and you're going to have a lot more pain. Like, I'm not saying that if you have anorexia that you're going to feel any less pain, but bulimia really does destroy your insides. Like, it destroys everything from the lower of your bowel to your teeth. It's the unnecessary side effects of trying to be, in your mind, perfect when most likely you already are to somebody. I strongly would suggest that if you are feeling any of these symptoms or you are dealing with any of this, that you should go get help, because, like I was saying, the side effects of this could last you your lifetime. I found out that Canadians' healthcare when it comes to eating disorders is absolutely atrocious. So if you are a person with an eating disorder, you are going to find it very difficult to get help unless you pay out of your own pocket.
Like Adrienne said, an eating disorder of any kind, whether it's anorexia or bulimia or any of the other ones we are going to talk about, I want to make sure the younger audience who may be watching this is paying attention. Because when you're young, when you're 10, when you're 16, even 18, sometimes you feel invincible and you don't understand the full effects that this may have on your body. And for parents who may be watching this video, what I really want to say to you for advice is to make sure you are a good role model. Your children will have enough pressure from the media and from their friends to obtain the unrealistic body weight that magazines and movies put on us. So try not to express dissatisfaction with your own body and weight in front of your children. And studies have shown that parents who display dissatisfaction with their bodies are more likely to have children with body image disturbances of their own. I know this is a lengthy subject, and I know this is only part 3 of our eating disorder series. And we're taking it slow because we don't want to be overwhelmed, and we want to make sure we get our facts straight and our information out there, and we want to make sure people are watching. So please subscribe so you can follow us and know exactly when the next video gets posted. And click like if you like this video, and dislike if you didn't. We totally need the feedback. We need to know where to go from here. And if you have comments or stories that you'd like to share, you can remain anonymous, but email us. We'd love to hear from you. And that is that for this week. Adrienne, I think we're going to say goodbye.